Thank you, everyone. So today is the 1866th day of uninterrupted daily webinars of the International Forum for Promoting Homeopathy. Today's our distinguished guest is Professor Dr. RASHMI Shukla, MD, founder and CEO of HOMEOED. Dr. RASHMI Shukla has an impressive background with over 16 years of rich clinical experience and more than 12 years of teaching experience. She has published several research papers in the field of homeopathy and has been the proud recipient of numerous awards for her outstanding contributions. She was honored with the Pride of Homeopathy Award at the World Health Summit held at JW Marriott, Dubai in 2022. So, through HomeoEd, Dr. Shukla is playing a pivotal role in modernizing homeopathic learning and empowering practitioners with evidence-based insights. So, she will be sharing her expertise on a very important and relevant topic today on role of homeopathy in endocrine disorders. So we are very certain that today's session will be enlightening and giving us very important tips for our daily practice. So I I welcome you, madam. Please start your session and share your experience and knowledge with us. Over to you.
Well, I think Dr. Rashmi Shukla has not joined. Please let me call once again.
Okay, sir.
Yes, Dr. Rashmi Shukla will be joining within 5 minutes. She's at a traffic jam. That's the reason why we couldn't start the session in. Yes.
Okay, sir. Yes, sir. So, hello, madam. And on behalf of IFPH, excuse me. On behalf of IFPH, I extend a very warm welcome to Professor Dr. Rasmi Shukla. Madam has a very impressive background and she has 16 years of rich clinical experience and 12 years of teaching experience, and she has also published several research papers in the field of homeopathy, and she has been awarded with numerous awards, and also she was honored with the Pride of Homeopathy Award at the World Health Summit held at JW Marriott, Dubai in 2022. And Dr. Shukla is uh, playing a very important role in modernizing homeopathic learning and empowering practitioners with evidence-based insight through HomeoEd. So on and today's evening, she will be sharing the expertise on a very important and relevant topic, role of homeopathy in endocrine disorders. So, ma'am, a very warm welcome to you on this platform. And now over to you. And please begin your session. We are waiting for your guidance and your experience. Please
Thank
share
you
with
so
us.
much. Thank you so much, doctor. Now I have come here for so many times that I hardly feel like as if whenever you only give introduction, then I feel like I'm guest, but otherwise I feel like it's family. So, but if it's a protocol, then yes. But I don't think every time the whole introduction is required. And I'm extremely sorry that I'm joining a bit late. But yes, this time this is going to be a very kind of revolutionary presentation, because why I will call, because always we choose what we want to say. We don't usually I personally present what I'm preparing, what I'm researching around, what I'm doing something around, or some cases, something, whatever is, now is on my mind. Usually we just compile that learning and some aha moment. Okay, this is what I have learned. This is what I want to share with people. So usually most of presentations are crafted around us. I mean, all of us would agree that this is how we usually proceed or select the topic of presentation. But this time this presentation topic was given to me when I was invited for a session or seminar into a homeopathy college at Vadodara, and there I was given this topic, that role of homeopathy in endocrinological disorder. I was like, yeah, we have got so much of role. Means why we I never thought of usually I usually prefer giving clinical or fundamental research based presentation, as you have been observing. But when this kind of clinical topic was given to me, so I thought, of course, I had to research, and I actually am so happy, and I'm really regretting that why I did not studied this topic so well, since the presentation was meant for Gujarat. So I have also covered that state statistics, that how the endocrinological disorder is spreading in India and state, specifically Gujarat, and how exactly it is affecting, what kind of role responsibility that homeopathy has to do with. And you would see lots of surprises soon. So I suppose my screen should be visible now. Is it?
Yes, it's good.
Yes,
Okay.
ma'am.
Perfect. So I really, and even every one of us, if you have not taken this topic seriously, I never took this topic so seriously, but I really regretted that why I should have taken it or studied it beforehand, is what I really felt once. Yeah. So let's suppose that now the whole screen and all of its contents are very well visible. So role of homeopathy in endocrinological disorder, as that was expected by them. So I prepared, I studied over it, and I had so many discoveries that this is what we do day in and day out, and this is what we need to know. So everyone should be able to have that kind of aha moment or connection they would be able to feel once they go through it. Now, as we know, what is endocrinological disorder? So let us come up with, first of all, the statistics. First of all, we should know that PNE axis, psychoneuroendocrinologic PNE axis, everyone, that modern medicine has forget, but we should also try to understand that this is nothing but the same clinico-pathological evolution of the disease that Hahnemann did propagate at his time. The disease mostly originate through his surrounding into some functional kind of imbalances, and then giving or localizing into certain kind of tissue or pathology. So what that particular I wanted to intend to come out of it, like what exactly the burden of endocrinological disorder is that does exist in India and Gujarat, and what kind of impact homeopathy and homeopaths are created. So again, as usual, all my presentation as they are always statistics based. So you would see lots of numbers so that we would have enough of confidence, because this session was meant for interns and final year students. So they really wanted to understand and have a confidence in what homeopathy can do in this kind of biggest challenging clinical calamity, I'll call, because the numbers are fixed, probably more than calamity you would also feel. So scientific rationale I have tried to give, so that students and all of us are also able to retrust that this is the impact that we are able to create despite of all the odds that we are facing. So what we know is, as we all know, that endocrinology is basically study of hormone producing glands and the disorder associated with it, which is the simplest form that I can explain. But it largely includes hypothyroidism, diabetes, obesity, osteoporosis because of lack of parathyroid hormone, and others. So we have got a spectrum of diseases or illnesses or manifestations of these kind of conditions. Now you can link every thing or probably every other patient in your routine OPD with this. that some or the other ways now PCOD, PCOS and thyroid is like almost a kind of epidemic that we can see around. And the diabetes, we have become world capital diabetic. And I am not feeling so happy to say that Gujarat is also the diabetes capital of India. So in a way, Gujarat is standing first as a state when it comes to the prevalence of diabetes is concerned. Now, we will not emphasize much of the stats of Gujarat because it's not required really. So let us focus that how things are growing and how things are actually are about, and what kind of insights are you kind of experienced people require, because we have to have certain matured understanding. So basically PNE axis, that is psychoneurocrinological axis, refers to intricate interaction that, as we know, that psychology, neurological, it means nervous system, and endocrinology. So these three systems the complicated intersection of function, which is very essential. Jitna as complicated as it is, that is even that important it is for human body to play its role to maintain all kind of balance. And most of health and disease, um, what do we call, homeostasis, it has got biggest share. So now the spectrum is, wherever there is imbalance, there would be endocrines and hormonal imbalances would be involved, and based on that spectrum is will be called as endocrinological disorder. So basically, what is PNE axis? PNE axis is basically, if you see, there is a hypothalamus, pituitary, and ovarian axis, and hypothalamic, pituitary, and adrenal axis. So these two axes and other neuroendocrinological network that does exist, which are essentially making a kind of ecosystem where every smallest or biggest human functions, our emotions, everything is linked with this. So it is a very, very important axis or part of physiology that all of us should be knowing. So basically it is its basic function is usually maintaining a physiological balance by regulating stress, mood, and hormone production. So its main role confines to balancing your mind and emotions, so that the hormones and the other segment of axis are working into normal limits. Now, any chronic disruption of any axis, the person is overstressed and overburdened by, from somatic, what we can say, credit to 60% of total human illness causes, excluding the infective causes, would be around this PNE axis only. So all stress-induced dysfunction, basically of prolonged disruption, causing prolonged disruption of PNE axis, usually it increases the risk of endocrine disorder. Then body finally gives up, stops, or tries or exhausts all its coping mechanism, and then somehow it just gives up and start throwing the symptoms of diabetes, thyroid, and other reproductive hormonal disorders and adrenal disorder. So this is PNA axis is what. And now the dominant thing is, we would just try to understand the two separate axes. Basically chronic activation of HPA axis, basically from psychological stress, may contribute to worsening of diabetes or development, is causative. Then Cushing syndrome. So what lies in HPA axis is Cushing syndrome, Graves' disease, and other endocrinological pathies like hormonal levels and feedback loops, that we know that, and the most famous examples are TSH2 thyroid hormone, like all feedback loops, that once the front end gland is stressed, so you would know that that feedback loop is already there. Suppose, for example, let me focus on this point. For example, if a person has started his thyroid has started diminished in its function. Any reduction in the function of thyroid is there, and the thyroid hormones starts falling down or reducing its level. Automatically, as a part of feedback loop, TSH will rise, and this many a times you would see pre-diabetic, pre-thyroid phase or subclinical hypothyroidism phase that does exist, where you can early detect by identifying, for example, very commonly, hyperinsulinemia is a pre-diabetic phase. So you can arrest any diabetic beforehand or diagnose a diabetes even before his sugars gets erratic by doing this insulin level. Even it has got another backend, that is inulin, but since it would be too deep to getting into only one disease, because we are taking a general overview. So these are two examples of feedback loops where if hyperinsulinemia is there, it means that there is a pre-diabetic condition that is existing, that soon patient will end up into diabetes. So these are feedback loops. These are examples of feedback loop. So neuroendocrinal mechanism, basically underlying changes, usually when you see around menopause, there all kind of mood disorder would have some or the other relation with endocrine. Reproductive endocrinopathies, which is very common. If you see the sub-fertility, the cases rising in the name of sub-fertility, where all investigation, all reports are normal, and still the couple is not able to conceive, is sub-fertility, and it has got some or the other kind of endocrinopathy that is beyond reports. So with feedback loops, usually, so they, if they are like in that feedback loop, so you would see there won't be any disruption in the general investigations, but the patient is equally suffering from all the symptoms. So hormones, usually mental and physical both levels they are affecting. So feedback loops, what again we will understand is neuroendocrine mechanism, basically, which is underlying seen, which we usually see menopause, mood disorder, reproductive endocrinopathy. It has got a loop, feedback loop between neurotransmitter and hormones that is influencing both mental and physical. So before the symptoms or the any disorder is manifesting clinically, the feedback loop is already in action, and it is in a way hinting at that something is not right, what we call as prodrome, and the body seeks attention through various symptoms, or nowadays you would see lots of unusual kind of examples where hardly a body ache might be a hint for diabetes. Sometimes nowadays very uncommon symptoms, I have seen patients suffering from a very refractive kind of headache which is not responding to any kind of medication, might be having high sugar. I have 20 years back when I was pursuing my MD, I've seen one case where patient has started unexplainable pain in his two fingers, and that too left or right, I don't remember exactly, but these two fingers he was consistently severe pain he was experiencing, and no one suspected, everyone suspected that it should be a cardiac pain. He underwent all kind of diagnosis or all kind of investigations, and by default as a routine his sugar found to be 400 plus. So these kind of unusual symptoms that does exist, so we really have to be vigilant while evaluating any symptoms and diagnosing, because it could be a very very unusual kind of prodrome that we might bump over. So endocrine dysfunction usually lead to neurological manifestation like headaches, myopathy, or cognitive changes. That shows close interdependence between nervous and endocrine system. If you see, basically the research in PNE integrates psychology, neurobiology, and endocrinology, because they are so interconnected, they are so inseparable, and that is where Hahnemann always wanted to emphasize that this whole body is a symptom, is a so integral part and so connected with each other, and that's why the holism, when Hahnemann promoted, then modern medicine advanced, then you got specialty for every system, but ultimately modern medicine has to come back to the fact that the ultimate concept of holism in understanding the person, its disease and treatment. I think soon they will also consider holism as a best treatment protocol also, because that is the best healthcare or patient care that we can offer when we approach a patient holistically. Because if you know, there are so many jokes now. You have ophthalmologists, then you have retina specialists, then you have some cataract specialists. For in dentistry, you may have specialty for every 32 teeth. So every teeth of your jaw. So I mean, there are no limits to specialize. So but ultimately, once you understand the crux that the whole system is one, they are interconnected, and one should be able to gauge holistically that what's the problem. So irrespective of wherever, whichever system the results are there or the symptoms are there, the root cause has to be understood and found. Somewhere modern medicine physiologically have understood that holism that does exist, and I hope pathologically and medicine wise also they would soon recognize that holistic approach is something they will ultimately have to find a solution to all clinical issues. And this is where I really feel proud when homeopathic principles, the principles laid by our master Hahnemann, proves its point over a period of time. Any scientific research supports that. I'm really happy, more than happy to know that. So homeopathic medicines basically, what we do is we always approach patient holistically. Okay, I had a case. I'll just it has nothing to do with endocrinology, but the kind of holism. Um, Day before yesterday, I got the same patient, and she had bleeding piles, fissures, constipation, and all. And I said, how everything is going, why this has happened, why it triggered. She came to me probably 4 years back, and then now again she is getting this kind of symptoms. So I said, what's wrong, what happened? And she never had any other symptoms in between for these 3-4 years. So I was like, why, what's the reason, what's the trigger? And she said, nay, everything is fine, I did nothing, I'm eating well, this that. I said, okay, based on whatever symptoms I got, I thought nitric acid could help her. I prescribed nitric acid. Immediately today, after 2 days, just before yesterday she came, today she came again, and I was wondering why she came again. So it's so soon patient came only in two situations: either they are worse or they are better and probably wants to continue for the another health issues. So she said, in this case, she said, no madam, I bled yesterday also. Yesterday I had a worst constipation, today I had bleeding, and I was wondering why she's not better, why she's not better. And while prescribing, I was talking how is life, this and that, because my dispensing person is taking a bit more time in preparing the medicine. So I was like, कि चलो बात कर लेते हैं. And she was like so composed, so calm, and everything is सब अच्छा है, सब ठीक चल रहा है. And as a जैसे as routine मैंने पूछा क्या चल रहा है लाइफ में, क्या कैसा हो रहा है, क्या हो रहा है. तो वो उसने परसों भी उससे मुझे शी डिस्कस सर्टेन थिंग्स, बट वो सब ठीक ही था, ऐसा था. टुडे शी ब्रोक डाउन, शी स्टार्टेड क्राइंग. एंड मैंने ऐसे ही बोला कि सी योर बॉडी depicts what your mind holds. So constipation means the body is not able to remove the waste which is not essential and probably harmful for your body. So your mind is also probably sometimes linked with that, it is not able to get rid of those junk thoughts. So sometimes this kind of relations that does exist with your mind and body. And she immediately broke down, she started crying. And I said, okay, now what happened? And then she told that she just had a break of just 2 weeks back. So how it it affected, what she's going through, this, that. And then I immediately changed my prescription to Ignatia. But I am very sure that within 24 hours she'd be all right. So, but then you see psychosomatic correlation, it is so strong and it is so visible. And every homeopathic medicine has got some or the other mental symptoms as a factor. So we always had been taking care of this PNE axis ever. All of our medicines had reachability towards this PNE axis ever. So we should be proud that we had always been operating at PNE axis level. Now what would happen? I gave her agnesia. It will release her mental stress. Eventually her physical symptoms will be all right. We all have seen n number of cases day in and day out like this. So what are we doing actually? We are actually operating and balancing that PNE axis. And it means that homeopathic medicines has got reachability to that axis. And this is where we really need to put up our research paper likewise, that where exactly, because that is where we get stuck when the questions are asked about the efficacy of homeopathic medicine, where it is going, how it is acting. So we should be able to demonstrate that this is where we are able to act, because we are reversing what exactly triggered, what the causation is, what exactly we are reversing. So homeopathic medicines are sometimes selected, sometimes always selected over restoring this PNE axis harmony, and almost always every disease condition the PNE axis has disturbed. And more or less we cover that. We always take care of their moods, mind, psychological, neuropsychiatric disorder, any condition if it is there, irrespective of that. We always, even if it is a headache, case of headache, we'll go into moods, what it is. Now they have put up that entity as tension headache. But every condition, if you see APD, last time also I termed her as it is APD, and it is stress induced, but I never knew that what kind of stress she is going through. So if we get the real details, so we can have always an upper hand. So some evidences basically suggest that homeopathic remedies may exert indirect neuroendocrine effect. Of course it cannot recover a case without touching exactly those burning spots. So if we know the origin of the disease, we know that we are sealing those gaps, and this is where reachability of homeopathy is. So now the mechanism, again, it's an area for ongoing research. Just now I mentioned that we should be able to demonstrate that where exactly we are able to act. So PNE axis is central to understanding the dynamic relationship between mind, nervous system and hormone, and we should salute Master Hahnemann's institutional intelligence and wisdom, that he could foresight that this could be some trinity of mind body health that does exist. And this is where we need to work, and this is where homeopathy will work, and this is where actually homeopathy works. And this is where homeopathy actually, whenever a case is coming with fever or any condition, or probably a diabetic, we are not giving them any medicine which has got uh, you know uh, any hypoglycemic properties. So then why we are not giving any hypertensive patient any vasodilator or any kind of statins? We are not having that kind of actions, essentially pharmacologically proven action likewise. But then still we can see the results. So from where those results are coming? So this is all basically a very very proud understanding that we should carry, and we should propagate to our homeopathic fraternity and patients also, that this is the depth that homeopathy is able to act and restore the balance. Coming to the next. Now if you see the population statistics, so this is the statistics of 2025, where we have 6960 number per lakh. Basically this is the forecast of 2025, and we have ongoing projection that probably this number would go rise more that is 8,585 per lakh by 2031. So this is one entity, but you see, if you see, diabetes has got bigger, because the biggest endocrinological number that does exist very significantly, we'll see all the charts where you would see that, you know, the biggest endocrinological disorder that is affecting the humanity, I'll say, is diabetes. So once I realized, because I am seeing patient thyroid, PCOD, PCOS, diabetes, I never recognized that this is the system, and this is the, you know, what do we say? This is the bigger area that homeopathy is very effectively creating results. The numbers I'll show you soon. So diabetes is amounting the biggest kind of health hazard, which is non-infective, and now diabetes itself has another entity, that is disability adjusted life years, where the person affected lives a kind of life which is disabled with diabetes. So it could be 1160, like patient who are affected by diabetes and now having some or the other kind of disability, and the number should be 1160 per lakh by 2025 is something projections that we are expecting, only with one condition, that is diabetes. The second largest condition that we are able to face is hypothyroidism. Basically it is affecting 3% of population, and it's a big number. And hyperthyroidism affects less than 2%. My question was, iodine, everyone is consuming that iodine yukta namak, and still the patient are suffering from hypothyroidism. Then now they have understood that the biggest number of hypothyroid cases are out of autoimmunity. Again, autoimmunity, which is a forte for a homeopath, and that's why, and that's where homeopaths are creating better results in hypothyroidism. We have got cases where patient, even if having 100 microgram doses of thyroxine or thyronome, and they are reverting back to normal. And I have got, within few days also, I have seen the TSH has dropped down, and patient is restoring on an average 9 months to 12 months to its normal thyroid medicine, with all tapering off of whatever thyroid replacement, hormonal replacement the patient is receiving. And I have also kept the follow-ups of those patients where for years patients never, even if they are checking, getting their thyroid checked, they are never getting back with thyroid disruption ever. So these are like permanent things that are happening. But as MICR and the WHO has removed the entity of cure, but I think this should be the cure, and they don't have concept of cure because probably they can't cure. We should be proudly taking credits that we can cure. So thyroid, hypothyroid, I think all of us must have experienced that we are able to cure thyroid patients very easily. Hyperthyroidism, which is one of the very dreading kind of horrible kind of disease, and very limited modern medicine has got into it, but we are very successfully able to revert those thyroid disorder in either ways. Now the another part of the story is obesity. Obesity has amounted, it's basically not exactly itself, pehle bolte the ki obesity is the mother of all diseases. Now we are calling obesity itself a disease. Any unusual and abnormal weight gain because of any reason, usually mirroring some or the other endocrine or metabolic disorder. If you see patient, if the person is overeating, still this is a metabolic issue. The patient is feeling more hungry and eating, living unhealthy lifestyle, definitely he has started with metabolic disorder. So this prevalence, which is very horrible to see, that 1998 we had 11.8%, and now in 2016, that is the latest figure that we have, is 31.3. So it's a big rise. It's almost 3 times that obesity number has gone up in India. So if you see the other endocrinological disorder, where thyroid, parathyroid, pituitary, adrenal, and bone disorder, this has this kind of statistic that does exist. So if you see the chart of the disease contribution, so majorly diabetes, hypothyroidism, and all other. Overall burden basically of endocrinological disorder is increasing. This is the general population numbers that we know, or the trends that is being seen. And the second biggest challenge that is, excuse me, that second biggest challenge that we are able to see is diabetes and its related disability. So if you see, Gujarat is the capital of India when it comes to diabetes. So obesity and diabetes medicos is also affecting doctors. So 20% obesity prevalence, 53% diabetes, and 24% of hypertension among medical professional of states. It's not general stats, it's Gujarat. So impact of homeopathy, what we now, this is the interesting part of the presentation starts, where you can see the how homeopathy is been approached, how it is been utilized, and what kind of results it is able to show. So if you see that patients response to homeopathy, if you see 86% mostly they are finding improvement, and these are all documented um, data or statistics. You can see the source that from where this particular data, if you see the source from where this particular stats has brought up. So you see, it's a major portion where homeopathy is able to show the results. 14% there were no change, or probably some other things happened, and 86% is a big number, where also patients are willing to go back to homeopath and give the follow-up and willing to continue the treatment. And it is one of those people support that we are getting because of our good results, that every person who is benefited by homeopathy are coming back and giving credits to it. So what we can see, the bigger improvement, basically, if you see that majority, about 11% of patient has reported major relief. Major relief means, I would like to quote one case of diabetes. The person was posted as general manager WCL Dhanbad, and he was consistently maintaining around 450 sugars, 450 post lunch, 250 fasting, and he was taking almost 100 units of insulin, and despite of that insulin he was having these kind of numbers. Patient insisted that he could not somehow come up, and that time that there was no concept of WhatsApp or WhatsApp call, WhatsApp video call, or Zoom call. Only Skype used to exist, and patient was not comfortable with that. He only on phone. I was holidaying in Goa. At that time, he called me and he showed that these are my reports, and I need your help. And over phone, I took his case. I understood his case. I found him to be a constitutional case of calcarea carp. I posted him medicine from Nagpur to his place, and that time I told him that to contact the day exactly 7 days after he starts taking medicine, he should be reporting me that what has happened. So he probably received medicine on Friday, and Saturday So he started medicine. Next Saturday, he gave me a call. I asked that how everything is going on, and the person tells that, Madam, abhi sugar 150 ke around reh rahi hai. I said, okay, very good. Now, what are the how much of insulin that, and I never expected that, and I expected कि sugar कम हो गई है, and ठीक है, इतना ठीक ही है, 150 250 तक के आ गई है, अच्छा है. I said, how much of insulin you are taking? And you all know that insulin patients are guided to calibrate the insulin doses every time. This person was taking 40 40 20. I think 20 40 40 probably. So he was given the medication, or for 40 missed these kind of fractions he was taking, and the patient was instructed usually to check the sugar before meals or post meals. Every time pre meals they should be checking it, and then accordingly they should be taking the insulin and then taking the meals. So I said, how much of insulin you are consuming now? So he's injecting. So he said, Madam, I am taking around 10 to 11 units of insulin. I said, what? And he was like, Madam, 10 से 11 units ही insulin ले रहा हूँ. मैंने बोला, wow, 250 150 150 around 250 post lunch, 150 fasting, and with 10 units of insulin. So here's the trick basically, that anti-diabetics mostly are working to lower the sugar levels than working over the insulin resistance. So ultimately the case becomes more and more insulin resistance resistant because the issue is not addressed, and we start again injecting insulin to them. Then where actually the things are going, it is going nowhere. Only reducing sugar level means the systematic anti part is not what we play curative part, where we actually work at insulin resistance. So that is where homeopathy acted. That insulin was very much there, but only utility by cells, by opening those uh, insulin resistance or glucose gate in the cell wall, was something that was needed in that patient, and that is where homeopathy acted. So basically what is happening is this kind of major relief are been also documented, and you see these are very minimum number that are being documented. You see majority of numbers that we are seeing day in and day out and curing it, they are not documented yet. So the impact and numbers are much bigger. Let it be disease, let it be disease complication, it's any statistics for that matter. Please understand that hardly 40% are reported, so you can understand the number actually is there at the ground level. So basically majority of patient basic overall diabetes and the other endocrinological disorder, they have notified that they have got significant improvement. Homeopathy basically is accessible to, here again I'm saying the numbers, say it's much beyond the numbers that is there. Almost still 100 millions of patients are regularly solely homeopathy, they are depending on, not exactly it should be 10 million I guess, 10 million of patients solely dependent on homeopathy for healthcare needs and endocrinological cares. So this is what Lancet is saying. So government studies basically are affirming that homeopathy's cost effectiveness is very strongest point and weakest point at the same time. But now let us focus that what exactly we can be playing a role. So large scale mein we are, if integrated or allowed to be integrated, and a kind of policy or structure of treatment protocol of all diabetics or endocrinological patients are laid down, then homeopathy has got certain level of um, disease stages or condition where it will be able to reduce that disease load or patient load overcome the system with such a easy, user friendly, cost effective methods. So basically what we expect is we should be integrated in primary health care in forthcoming pluralistic or multidisciplinary health policies, where we should be given free hand to treat metabolic and endocrinological disorder is what we expect. And there are certain big institutions who are showing this kind of results and the scope of action as well. Now, the patient adherence, basically 62% patients are coming back to homeopathic clinics for follow-ups, and this shows that the patient's trust and the results that homeopathy is able to create. Now, if you see that diabetes prevalence, if you see, this is the forecasted number in 2025, and homeopathy is giving 86% cases make clinical improvement. Thyroid disorder, 3% say 2%, मतलब almost 5% of various thyroid disorder. Here, individualized homeopathic medicines we are giving, and the results are 100% is what I feel. Most of the thyroid disorder we are easily able to handle and manage. Obesity, 31.3% basically is the number. Your homeopathy being able to cater the metabolic disorder, and we have got also the concept of constitution, which are based on some or the other metabolic need of the or the need metabolic types of the individual. So we have got definitely a good reach when it comes to obesity, because we can very well control this but if we can control metabolism, we can easily control obesity. Here I would like to quote one example. I had one patient who was 140 kg, who started gym, who started doing all yoga, workout, and every damn thing whatever he could do. And what happens is there is a plateau phase that comes up. Every obese patient do face that initial losses of 20-25% of his overweight. Then the weight becomes static. It doesn't go either ways. And nowadays gym do have a kind of mechanics or machines which also shows that in body test that shows that what is the visceral fat, what is the muscle mass, what is the uh, general fat. So also it also shows you your BMR. Patient's BMR was 1000, around 1008 or something, and expected BMR was around 1600 or 1800. And he's saying, I'm trying so hard, I'm working almost for 4 hours, I'm playing badminton, I'm doing yoga, I'm doing gym, and still I'm not able to improve my metabolism. Could you please help me? I took his constitutional history. I gave him medicine, and it is a documented case where the metabolism here. Why I remember, because this was the first case which I could see through my eyes that how homeopathy can improve the metabolism. And within 6 weeks, he undertook the test again, and at that time the reading was around 1400. And why I can remember those figures so well, because they were your first case, and then you remember everything of that sort. So that is the impact that obesity homeopathy work over all kind of eating disorders and metabolic disorders. So where the space of obesity will be left, and once obesity is curbed, diabetes will automatically be curbed. So we are very well complementing the need of endocrinological disorder each and every stages.
Excuse me, ma'am.
Yes.
Yes, only 3 minutes left for our session, ma'am. Try to.
Okay. Yes, it is a conclusion.
Okay.
So what we want to understand finally is homeopathy offers a very holistic and individualized approach, which is we are able to manage and all kind of endocrinological disorder, because they are functional mostly. And even before structuralization or other kind of complication, more and more screening screening time itself. Probably I used to approach, because I worked a lot over diabetes, and we used to get a full-fledged diabetic OPD at our institute for clinical research, Mumbai. is Palghar, from where I have done my MD. What we have used to promote is that if both parents are diabetic, the child is likely to be carrying the gene, and earlier ages he should be taking some constitutional homeopathic course so that he won't get diabetes altogether. So this is the preventive angle. So we all have good scope once we know that where we can play and how big our ground is. So this is where I would like to conclude. I hope that it was some substantial and some real good substance that I could add through this presentation, some new points, some new insights. So now the session is open for question and answer and discussion.
Thank you so much, ma'am. This was really a very wonderful and scientific presentation with uh, uh, all the evidence based and with numbers that they are showing, and it's really very much wonderful. And we have 2 minutes more, so I request to all the participants, if they have any query or any questions, they can raise their hand, or they can type in chat box.
Yeah, sure.
Only one minute remaining. So, and I would also like to say that yes, in this time, due to all this changed food habits, and nowadays you already mentioned that obesity is already a condition that is itself a disease. And nowadays, from few years, in childhood obesity, that is drawing our attention very well, very much
Yes.
focused, like in the children's only they are facing this obesity. And in early 30s, like we are saying that 30s is new 60s, so all these metabolism disorders, they are experiencing in very early age. So these numbers showing itself that India is to the capital of diabetes, and thyroid is also very much prone here. So yes, we need to focus on that. And yes, homeopathy can do wonders, that so many allopathies are also coming to us for their these metabolism disorders.
Very
So
true. Very true. Very true, doctor.
yes, ma'am. So I can see no questions are there. So thank you very much, ma'am. And I'm
So
very much looking forward to see the next part of this, because I think some slides are left, and I am very much curious to know more about this, and see all this evidence-based, what are all the numbers, and how we can proceed, and how we can do our betterment, and improve ourselves in this field, so that we can serve well in the community.
I always thank IFPH for giving me second chance, because most of my presentation has part two. Up to your curiosity, I'd like to say that the following slides were to have that miasmatic clinicopathological correlation and miasmatic angle of the all endocrinological disorder, and how homeopathy has or can manage that too, and how well homeopathy can manage is something I have quoted. So probably I would look forward towards Dr. Danesh and every one of you, that we would
Okay, please
sit
conclude.
again to discuss over it.
Yes, yes. Thank you so
Thank
much.
you.
Now
Thank
I'm handing over this session to Malayalam session. Thank you, sir. I'm sorry for the delay, sir.
Thank you. Thank you.
Thank you.